So today we're going to be talking about poems, and I just want to make a shout out to Suba's friend Ed for talking about poems today. So when would papilledema constitute poetry? And that is poems. Poems is an acronym. It stands for peripheral neuropathy, organomegaly, endocrinopathy, the M protein spike, and skin changes. So when we're looking at the past medical history in someone who has papilledema or optic disc edema, if you look in their past medical history and you say, wow, this person has a peripheral neuropathy, has organomegaly, hepatosplenomegaly, for example, they have had a lot of endocrine things and endocrinopathy. They have a monoclonal gammopathy of an uncertain significance, and they've had either skin or nail changes. So there's some things that if you look in the past medical history, you can make the diagnosis. So if we see in the PMH, peripheral neuropathy, organomegaly, endocrinopathy, MGUS, and skin changes, you really should be thinking about poems at that point. And poems, the key and differentiating feature is the presence of the monoclonal gammopathy. So as you know, when you do a serum protein electrophoresis, you have albumin and then you have alpha, and the electrophoresis will generate this monoclonal spike. That M spike is sometimes of a certain significance, like multiple myeloma or smoldering myeloma, and sometimes it's of the uncertain significance. It hasn't developed into myeloma yet. And so the basis of all of these problems is the plasma cell. So it is a plasma cell dyscrasia that is driving all of the features that are seen in the POEM syndrome. And one of the biomarkers that we have of the POEMs is vascular endothelial growth factor. And so one of the questions that was asked of me is, how could that produce papilledema? And basically, vascular endothelial growth factor is not just about endothelium and growth. It's vascular. And so the VEGF is just a marker of the hyperactivity of the inflammatory process that is occurring to generate the optic disc edema. And even though we call it papilledema, we really probably should just call it optic disc edema, because sometimes in poems you do the spinal tap and the pressure isn't that high. So it's not probably strictly an increased ICP thing. So it's not the same as the monoclonal gammopathy infiltration syndrome. So in the infiltration version of the monoclonal gammopathy, you can have cells that are inside the CSF and causing meningitis, a carcinomatous meningitis, or you can have direct infiltration of the optic nerve. These are the other mechanisms for optic disc edema. And so technically calling it papilledema in the POEM syndrome is probably not completely correct. We would just say optic disc edema. So when would papilledema constitute poetry? When you have a patient who has papilledema, peripheral neuropathy, organomegaly, endocrinopathy, a monoclonal spike, and the skin changes, and the biomarker, VEGF, even if it's just epiphenomenon, is still worth testing.